my name is Robert Weiss. I'm based in Baltimore. We have a large practice called the Maryland Laser Skin and Vein Institute, and I'm director of that. And I'm also past president of the American Society for Dermatologic Surgery. And we have a large number of lasers in our office and other energy devices. I would say the count now is around 45. So I'm going to try to help and share some of our experience with you to try to make it easier for you to decide if you want a device in your office, whether it should be laser, radiofrequency, and also to help you understand what works best in our practice and sort of the top 3-4 devices that are our go-to devices every day. So when we think about a practice of dermatology and we think about the patients that we see on a regular basis, certainly in the United States right now, we do have a large number of Caucasian patients that have photo damage. They also have telangiectasia or broken blood vessels on the face, and certainly we want to be able to have the devices to be able to tackle that correctly. On the other hand, if you have a practice where there's more skin of color patients, well, those problems are going to move more into the realm of melanin-related, sort of irregular pigmentation, melasma, post-inflammatory brown spots. And then the other problem that I think we see in all people is acne scarring, and any color skin as time goes on develops wrinkles from sun exposure, so we want to be able to tackle that problem as well. And I think the best way to look at it is to organize in your mind what you think, or basically a plan to sort of approach a patient and then decide what you're going to do for that patient when it comes to cosmetic dermatology. What I do is I kind of break it down into thinking about problems that are superficial, so that there are lasers and devices that will do things closer to or within the epidermis or very next to the epidermis. Then we think about a little bit deeper, which would be wrinkles and acne scars, which also include surgical scars. And then we go to the deepest level, which involves skin tightening, lifting up saggy jowls, but also, if you think of an extension of that, then into body contouring and removing excess fat. One of the questions that always comes up is, how do I get trained on this machine? I really want this, I see the need in my practice. How am I going to learn how to use this device? Because if I use it, I want to use it correctly, I want to use it safely, I want my patients to be happy with it. So what I recommend, number one, is that you attend like the American Society for Dermatologic Surgery. We have some sessions on laser. The American Society for Lasers in Medicine and Surgery is another great place. Sometimes that can be a little confusing because there's so much new information, so many scientific abstracts presented each year, that if you're a relative novice, it can be sort of overwhelming. But they do offer basic courses. There are great courses in treatment of vascular lesions, treatment of pigmented lesions, and you'll get the broad range of what everyone in this field who is experienced using these devices, how they use those in their practice. I strongly believe that of all the specialties, dermatologists are the most qualified to operate lasers, to treat skin conditions like increased vascular or unwanted vascular lesions, increased pigmentation, because we understand the skin and we are the most likely to use the devices correctly. So I make this appeal. I know that many dermatologists are so busy, so overwhelmed with the patient needs for day to day, but I think it bodes you well to spend some time looking at the devices, sort of update your practice to a very modern practice. Don't rely just on a hyfricator to treat everything. Yes, we all need the hyfricator. It's a very useful tool, but I think we've gone beyond that. The technology is there. we can safely and effectively treat vascular lesions in all of our patients, and certainly my point of view is that yes, chemical peels work really well and have been around for a long time, but we have things that go to much more specific depths and have much more predictable outcomes, and we should fully take advantage of them.